first video on YouTube. It was about choosing psychiatry and what a day in a life of a psychiatrist looks like. In that video, I spoke about a lot of benefits of taking psychiatry as a career option. Now, I spoke about having a good work-life balance. As a psychiatrist, you can listen to people's story, connect with them, and help them in that process. Also, there is the added advantage that you can work in different subspecialties. You can work in consultation liaison, you can work in geriatric, adult, you can work with children. So there's a lot of opportunities there. And also, psychiatry is a developing branch. So there's a lot of demand for it, especially post-COVID. It can be a very lucrative career as well. I know a lot of people who are practicing telepsychiatry and they work at the convenience of their home. In this video, however, I wanted to bring a more balanced perspective where I discuss about the cons of taking psychiatry. Now, it's not mandatory that you have to experience all of these disadvantages, but I've made a list after discussing with many consultants and many other colleagues of mine. So this is a more comprehensive list, but bear in mind that these are some of the challenges that you could face. Now, psychiatrists, as a part of their job, they manage a lot of very difficult and challenging situations. These situations could be things like suicide, sexual assault, domestic abuse. So as you can understand, very, very sensitive issues. Now, these situations are not uncommon. And while managing these situations, it can take an emotional toll on you and it can lead to an early professional burnout. What can you do to prevent this? You need to have a good work-life balance, very good professional boundaries, and there may be situations where you need to talk to someone like a therapist and take help when you're experiencing distressing emotions. One of the most inevitable consequences, especially in the context of burnout, is managing suicide. You'll talk to people, you listen to their entire life history, you'll connect with them, you're trying to help them, you're doing therapy, and sometimes, unfortunately, people may end up taking their life despite all of these help. That's just one of the terrible things about depression. So when this happens, the psychiatrist may experience grief and it can really take a toll on the mental health of the psychiatrist. Now, we've all heard about stigma in the context of how patients who seek mental health care experience stigma of varying kinds. Did you know, as a psychiatrist, you can also be subjected to various kinds of stigma? If I had 10 rupees for the number of times a relative had asked me, why did you take this particular branch? You had all other options. Don't take psychiatry. Your life is going to be very difficult. And the way that it was portrayed in media for generations doesn't really help. The way that psychiatrists are viewed as, people who give shock treatments always, and they give very, very harsh medications which end up developing adverse effects, or even worse, there are so many movies which speaks about like how psychiatrists become crazy themselves. Well, no, I mean, they're just normal people. They're also like any other doctors. And you'll have to kind of keep psychoeducating not only patients, but also like family, your own family, other doctors, other medical professionals about psychiatry, psychiatric illnesses, and psychiatrists. A good education system, a good awareness programs, spending enough time to explain it and giving them opportunities to discuss helps. Now, cost can be 2 or 3 things. How much of your time and energy you're spending towards becoming a psychiatrist. It can also be the financial aspect. Irrespective of which branch you take, residency is going to be hard. So your working hours are usually around 12 to 14 hours. Now, it may be lesser on free days where it may get over by 8 hours to 10 hours. On OPD days or more busy days like the post-OPD days, it may go on to around 12 hours, 14 hours. So you can imagine something like you'll come to work at around 7:30, 7:45 and you'll be done with work somewhere between 8 to 9 p.m. As a psychiatric resident, you are listening back to back continuously emotionally charged information. Okay, and history taking in psychiatry takes a lot of hours. Like just the history alone can take up to 2 hours. That is if you also know the language. So patient care is one aspect. Along with that, there's also a lot of focus in research in psychiatry. So you need to do mandatory research, posters, papers, and things like that. And you need to take undergraduate classes, so teaching as well. It becomes more challenging. Coming to the financial aspect of things, government colleges are very affordable. In fact, they will be paying you as they consider you an employee, and you'll have appropriately higher amount of workload as well. Now, in private institutes, although you will get a stipend, the amount that you invest, which is around 50 to 60 lakhs, is vastly higher than any stipend that you're going to get. Now, is this amount worth it? Now, here comes the controversial aspect. It really depends on your own individual background, skill set, and confidence in your skills, that whether this amount becomes worth it or not. Being very honest, I come from sort of a middle class background. Now, although we didn't have huge struggles in terms of food or shelter or anything like that, would I have paid 50 to 60 lakhs for a psychiatric MD? Possibly not. But psychiatry can be a lucrative career, especially in the context of private practice. Even in private practice, it will take many years for you to set up, become popular, earn the trust of your patients, and gradually, out of good reputation, you'll get more and more patients, so you can earn more money. But bear in mind, private practice skills is completely different from just academic skills. You also need to know how to network yourself really well. You need to be good at public speaking. And you need to have a lot of patience in managing very, very difficult situations. Even for a fairly simple procedure, someone who is trained as a surgeon can charge pretty high. They can charge anywhere between 5,000 to 10,000. Which, as you know, I'm being quite conservative. Now, in the context of psychiatry, can you charge the same amount? You cannot charge the same amount. Usually, therapy costs are somewhere between 500 to 2,000 rupees, depending upon how much of an expert you are and what kind of demand you're in. For some reason, people don't seem to think therapy services, where individuals are talking and giving skills training, is as valuable as any sort of medical or surgical procedure. There are so many investigative procedures also which are charged quite heavily in the context of medicine and surgical branches. But can you really compare them? I'm really not sure. But I can tell you for a fact that the pay is not as much as what your medical or surgical counterparts would earn. But what about the job opportunities? Can you just finish your MD and then immediately get a teaching position? No, you cannot. Tenured positions, especially in South India, in the major cities, are all quite saturated. In cities like Bangalore, Chennai, Hyderabad, in all of these big cities, the major hospitals and teaching institutes are saturated. If I have to give you an example, you know how there is a heavy competition for getting a NEET undergraduate MBBS seat, right? Similarly, there's going to be competition in NEET MD. Similarly, there's going to be competition for senior residency, for assistant professorship, associate professorship. To summarize, the job opportunities are a little more limited and the pay is not as similar as other branches of medicine or surgery. That brings me to the end of the video. But again, to remind you, there are several good aspects to being a psychiatrist, but I really just wanted to bring out a balanced perspective so that people are not skewed by seeing only the positives and they can make a very informed decision. And honestly, a lot of people don't talk about the negatives. And I wish I had known some of these negatives even before I took psychiatry, not because I would have chosen another option. I did feel in hindsight that I wasn't completely prepared for the position that I took up. I would have really liked a video like this. Thanks, guys. Subscribe if you like this video, and bye-bye. Take care.